So if you went to your doctor to talk to them because you feel horrible and you think you're perimenopause and menopause and you have ruled out other things like thyroid dysfunction and you want to proactively help yourself and you found that you were brushed off, here's what you can do. Now keep in mind, I trust that your doctor is a learned human, but they may not be a specialist in menopause. See, not everybody who is an OBGYN or a family medicine doctor has been trained in the transition to menopause. It is a little more complex than what maybe they were led to believe, and research has shown what we do before menopause transition in the last few years of perimenopause can help save future you, especially with bone density. So here's my thoughts. If the North American Menopause Society, which is now called the Menopause Society, which you could go to if you go to menopause.org, has the specialization program, the test that you can take to be a NAMS practitioner, you can go to a menopause specialist. How do you find one? You can go to menopause.org, type in your zip code, find a menopause practitioner near you. If there is not one near you, you can do a telehealth option like Alloy, MIDI Health, Heather Hirsch. Telehealth for perimenopause and menopause symptoms can absolutely be done by telehealth, and here is why. Perimenopause is oftentimes diagnosed by your subjective reports and your subjective complaints. And this is very important that you are heard and you deserve a conversation. Now, hormone replacement therapy is a very personal choice and is a personal conversation because everybody's perimenopause, menopause transition is very unique. There is not a one size fits all, and hormone replacement therapy doesn't fix everything. But if you're going to the doctor looking for solutions, help, and guidance, and they're not offering that, then you get to go to a menopause specialist and talk to them. So I would encourage you to menopause.org or do a telehealth. Now, the next conversation is, if you chose to do hormone replacement therapy, do know that they also are calling it the new version, this is just vernacular, menopause hormonal therapy. Sometimes they call it hormone therapy, but menopause hormonal therapy would not be the same as birth control. It is tailored to you and your symptoms. An example is estrogen. Estrogen could come in a pill, it could come in a patch, it could come in a spray. What matters is that it matches you and your life, and will you be compliant in taking it? The menopause patch, for example, comes in 5 doses. So they could start you at whatever dose that doctor thinks is appropriate for you, and you go off and try it and you see if your symptoms improve and do you feel better. If you feel great, good, that's your dose. If you still feel horrible, then that might not be your dose. So you go back and you follow up and you have a conversation with them and you guys work through that. And so I think we forgot to listen to women, and I think we forgot that even though this is a normal transition in a woman's life, there are other secondary things that happen. We have an increased risk of cardiovascular disease, our LDL is going up, our bone density is going down, our muscle bulk is going down, our mental health is hurting because if you have maybe undiagnosed depression or ADHD, there's no more masking, all that's come off. And so women deserve to be heard, and you deserve a conversation. So step 2 is to find a menopause specialist to have that conversation with you. Hope this helps.